Welcome everyone to the Learning with Fetal Alcohol Spectrum Disorder launch webinar. Very excited to be here today, and my name is Marie Thiessen, and I'm very excited to be part of the team who is bringing to you today this fabulous new resource. So I can see all of the participants clicking over and joining us. In Sydney here, it's very wet, but thank you very much for everyone who is going to spend the next hour with us. Before I start, I just want to acknowledge the traditional custodians of country throughout Australia and recognise their continuing connection to land, water and culture. I'm joining you from the land of the Camirigal people, and if people wanted to pop into the chat or Q&A where they're coming from, that would be fantastic. Thank you to everyone for joining, and thank you for recognising the continuing connection to land, water and culture of the custodians of land, and that we pay our respects to those that have cared and continue to care for country. Wonderful to see all of the different places coming through the chat. So just a couple of housekeeping things before we get started. First, we are in listen only mode, which means that we're not able to hear or see you, but we can certainly communicate with you through the chat and also through the Q&A box. This webinar is being recorded, and the recording and slides will be circulated to you afterwards. The webinar will also be available on the Learning with FASD website. And lastly, we will have a question and answer session at the end of the webinar. I'm very much looking forward to that. Please add questions to the Q&A box, which is available, and feel free as soon as we start to be thinking about what those questions could be, and we'll monitor the chat box as well. So who do we have presenting to you today? It's my absolute pleasure to introduce first myself, Professor and Director of the Matilda Centre at the University of Sydney. With me today, we will also have speaking Professor Elizabeth Elliot, who is Professor of Paediatrics and Child Health at the University of Sydney and Consultant Paediatrician at Sydney Children's Hospital Network, and very passionate about children's health. Elizabeth Pritchard, from Learning Support and English teacher and Coordinator of Student Wellbeing at Barker College. Wonderful to have Elizabeth with us here today and on this journey in creating these fabulous resources. And Dr. Emma Devine, Postdoctoral Research Fellow and Project Manager of Learning with FASD. And Emma is based at the Matilda Centre at the University of Sydney. So just a quick overview of what we're wanting to cover today. First, we will cover fetal alcohol spectrum disorder in an Australian context. Then we'll cover fetal alcohol spectrum disorder in an Australian school context. And finally, we want to present to you, and are very excited to present to you, the development of the Learning with the Fetal Alcohol Spectrum Disorder resources. And this has been the most rewarding and encouraging collaboration that we have been involved with so far. It has just been incredible to have so many people involved in this project, all wanting to create the best possible resources so that we can bridge those gaps and help as many young people and their families as possible. So first up, we have Professor Elizabeth Elliot presenting to us on fetal alcohol spectrum disorder in an Australian context. I'll just hand over to Liz.
Thanks very much, Marie. And just could I have the next slide, please? Thank you. Fetal alcohol spectrum disorder is a diagnostic term that we use to describe a whole range of neurodevelopmental, physical, psychological, and behavioural impairments that may be caused by prenatal exposure to alcohol. Now, although we've long known that alcohol use in pregnancy may harm the unborn child, it's hard to believe that still 50 to 70% of Australian women report using alcohol during pregnancy. Although preventable, we estimate that up to 2 to 5% of children born today may be affected by fetal alcohol spectrum disorder. And in the last 5 years, we've had notified to us at the Australian Register over 600 children newly diagnosed with fetal alcohol spectrum disorder. And each week, I assess and diagnose these children in my clinic in Sydney. Could I have the next slide, please? So fetal alcohol spectrum disorder is not just a problem of children, it's a lifelong disability. But what we do know that early diagnosis and appropriate treatment will ensure the very best outcomes for children with fetal alcohol spectrum disorder. However, those children who do not have an early diagnosis and receive appropriate supports have an increased risk of disrupted education, mental health issues, contact with the justice system, and later harmful substance use. Now, we believe that primary school teaching and support staff have a really vital role in the early recognition of neurodevelopmental concerns of their children. They have a role in connecting families and health services, and they have an important role in implementing supports in school to ensure that children who do have fetal alcohol spectrum disorder are well supported in their ongoing education.
Thank you very much, Liz, for giving us that overview of fetal alcohol spectrum disorder in Australia. And now I'd like to hand over to Elizabeth Pritchard to talk to us about fetal alcohol spectrum disorder in an Australian school context. Thank you, Elizabeth.
Thank you, Marie. Good afternoon, everyone. It's such a pleasure to be here speaking with you this afternoon and representing from a school context in this very strange world that we're living in right now. It's really nice to have a voice from how schools are going in this realm. I have a special education background, so I've worked with students with additional needs for approximately 20 years now in a variety of settings, school settings, support units, independent and Department of Education school systems. I work with children with FASD when I was working in a support unit with the Department of Education, and I'm so thrilled that these resources have been developed because as a teacher and someone who is working in this field on a daily basis with huge teams around us to support us, it's so wonderful to have such high quality resources and funding for something like FASD, because it is in the community, I believe, somewhat of an unknown quantity, particularly for educators and teachers and support staff that might not be trained in the field of additional needs or special education, as it was once called. So to have such reliable, easy to use and accessible resources that are so well researched, it's just outstanding that we have this sort of resource to go to. In my work with families with children with FASD, it was a really sensitive area to be working in because it was often something that parents found difficult to discuss, to talk about, to disclose, and then to work through. There was things like guilt or embarrassment or something along those lines that would often come when we sat down with the counselling team and myself and families in this area. But it's wonderful to have resources like this because it empowers teachers to recognise signs and behaviours and to have this resource and to be able to say, I think there's something going on here, and to assist in opening up conversations in this realm. When I was working in the support unit with students with imputed or diagnosed FASD, there's not been much available. So it was often the case that we, as special educators or as a school community, and this often happens with students with additional needs, we would often think that it was something else that was causing issues with this child. And in my work with the team around the FASD resource building, I often commented that FASD didn't come up in conversations. It was often, we found that children were often misdiagnosed with autism spectrum or oppositional defiance because they were presenting behaviours along those lines. With resources such as what we've developed here, it gives a base and a go-to for schools who often sometimes are navigating by word of mouth or what they've seen and heard and experienced due to the busyness of schools. And so something like this being brought to our attention in schools encourages us to look further afield and not just at ADD or oppositional defiance or autism and the things that we hear more on a daily basis. I think it's excellent that these resources are now readily available and can be distributed and shared amongst the school community so that these conversations are opened up amongst families, with school counselling teams and in the classroom. Students with additional needs is not just the work of your learning support team or your wellbeing team in your schools, but as I've said to the team in our discussions in building these resources, it's the music teacher that is working with a FASD child. It's the science and tech teacher. It's the art teacher. And often they're not trained, nor do they know the signs, signals, triggers of students that might have FASD. So to have resources like this supporting all of our teachers, not just those that work in a special educational support setting, it's wonderful that these resources can be accessed by everyone and shared in school communities. So I'm certainly thrilled that we now have a go-to for FASD and conversations can be started and resources shared amongst school communities, and that we're not just going to the diagnoses that we always hear or that we're talking about regularly in schools, that there are other things and other ways and processes that we can be supporting students in a more appropriate manner. I think what also comes out of developing resources like these is just from a school-based setting, how important it is that schools undergo more professional development and training in other areas that may not be as prevalent as some other diagnoses, but to be opening conversations and having conversations about other diagnoses and other spectrum disorders in schools. So this certainly opens up a wonderful dialogue for us as school teachers, and it's just really exciting to have resources that are designed for the busy life of a teacher. So it's been wonderful to be a part of it, and I'm really grateful. So thank you.
Thank you so much, Elizabeth. And I absolutely echo that one of the greatest joys of being involved in this project has actually been those collaborations and those connections that we've been able to make. So thank you so much for bringing your skill, and also thank you to everyone who has been on our expert advisory groups in bringing the skills. So thank you very much, Elizabeth. And now, without further ado, I get to introduce Dr. Emma Devine, who's going to take you through development of learning with FASD. And here we go. Thank you very much, Emma Devine.
Thank you, Marie, and thank you so much to Elizabeth Elliot and Elizabeth Pritchard as well for really setting the scene of what I'm about to talk about for a bit of this webinar. So, you know, going through the prevalence of FASD in Australia, how important an issue it is that we start developing some resources and some supports in that area. And from Elizabeth Pritchard as well, some of the gaps in schools that we're hoping to be able to support and sort of address some of those gaps as well. And maybe some of the teachers who are with us today can really resonate and agree with some of the things that Elizabeth was saying. And if so, we do welcome, your experience and your thoughts. So do please share them in the chat as well. So yes, I have the pleasure today of going through our development process for learning with FASD. So let me just get the slides up. So before I do get into the development process in more detail, I really do want to start by acknowledging the very, very many people who were a part of this project, who gave their time, their energy, their expertise, their knowledge, and shared with us. And importantly, I do also want to acknowledge and thank the Australian Government Department of Health, who were the funders behind this project as well. So getting into some of the exciting stuff now. The development of FASD took place in 3 main phases. So the first phase was research, planning, and consultation. The second phase was collaborative development and focus testing of learning with FASD. And the third phase was the dissemination, promotion, and evaluation of learning with FASD. So I will be going through these phases in a little bit more detail, sharing with you what we did at each stage and why we did those things, starting, of course, with phase 1. So the first thing we did was to conduct a scoping review of existing resources that provide educators with knowledge and skills, with the aim of building capacity to identify and support students who are displaying problems consistent with FASD in schools. And the real advantage to starting with a scoping review like this is that the process allowed us to map the available literature while also identifying key concepts and gaps in the literature that we could then go on to work on. In total, we identified 124 relevant resources for the education sector. And these resources really varied in types. So some were fact sheets, some were longer guides, books as well, videos, podcast episodes, games for students, which was quite exciting, as well as some professional development modules and interventions and programs. So of those 124, 119 of those covered strategies to support children within a school. So classroom adjustments maybe, or strategies, sort of teaching strategies. And only 23 were tools designed to assist educators with identifying these students who might be displaying problems or behaviors consistent with FASD. So we took all of these resources and we evaluated them based on their evidence base, how useful they were, and their quality as well. Alongside the scoping review, we also conducted formative evaluations with 18 FASD or education experts and 33 educators. So this included teachers, principals, learning and support staff, school psychologists, counsellors, among others. And we did have quite a good spread of people from metropolitan, regional, and remote areas as well. So from the review and the consultations, we identified a couple of key areas and needs. So these are gaps identified by the scoping review and also priority areas identified through the consultation process. So a key finding from the review was the clear lack of high quality evidence-based resources that had undergone any evaluation. So the evidence base and the strength of these resources was sort of lacking is what we found. So we can see that in the pink box up at the top on the slide that you're seeing. From the education and the educator consultations, so these are the blue circles on your screen, the consultation specifically emphasized the need for information on the impact of FASD on learning and behavior, a need for information on how to engage with parents and caregivers and to work with families, and also strategies that could be used in the classroom. And really importantly, both groups stressed the importance of easily accessible short format resources. And I think that really speaks to and aligns with what Elizabeth was saying earlier about being a bit time poor, and there's so many other sort of conflicting responsibilities and things in schools. It can be hard to sort of sit down with that longer guide and work through it. Some other areas of need that were identified were information on referral and diagnostic pathways. So we didn't identify any resources as well from our scoping review that covered this topic. And also tools to assist educators to recognize behaviors consistent with FASD as well. If you are interested in hearing a little bit more about the results of the review itself or the consultations, these findings have actually been published and are available online We're all pretty QR code savvy, I think, these days. So I have just popped a QR code onto the slide. But we do, as I was saying, always welcome any questions. Feel free to pop them into the chat or the Q&A box as well. And we'll get to it later on in today's presentation. So phase 1 is now done. We had identified needs from primary school educators and also the existing gaps in the literature from the scoping review. And the next phase of the project was the collaborative development and focus testing of learning with FASD. So the resources, all of them. So I'm going to go into the detail of the specific resources that are available on the website in a moment, but I just want to start with sort of an overview of the process through which all of the resources went through. So they were all developed using a multi-stage review process, and at each stage refinements were made by the research team based on consultation feedback. So just to explain that in a little bit more detail, we first used an iterative process to produce the first draft of the resources. So that was within the research team up at the top of the triangle on your slides. We then sent all of the draft resources to our expert consultant, who was an experienced educator with particular knowledge and expertise of FASD in an Australian context. After incorporating our experts' feedback, we then sent the resources to our expert advisory group and our education subcommittee group. And in total, we received feedback from 16 members. The research team then went back and incorporated this feedback before sending them out to review by primary school teaching and support staff, FASD and education experts, and parents and caregivers of children with FASD, where a total of 42 people provided feedback on the resources. So all the resources have been through, they're all evidence-based, and they've all been through quite an extensive review process with many eyes having a look at them, which is really great. And it was really, we're really grateful and really thankful for everyone who did help out with at each of these stages. It really was invaluable to make the best resources that we possibly could. So all of this research that we did at the beginning, all of these consultations, all of the collaborative development, it all has come together into the Learning with FASD website. So what I'm going to do now is go through the 3 main topics that we have on the website, including sort of an explainer and a rationale for why we focused on these topics, as well as the specific resources that are available for each. So the first topic that we decided to focus on for Learning with FASD was understanding FASD itself. We chose to do this because the consultations and the scoping review revealed quite a low awareness of FASD in schools, and I think this has really been reiterated by Elizabeth Elliot and Elizabeth Pritchard earlier on in this webinar as well, and also a lack of accessible and high quality resources. The consultations and review results also revealed a need for information on the impact of FASD on learning and behaviour, so how it presents in schools that teachers and support staff might be seeing, and that there is also a lack of information on the referral and diagnostic process. So that's why we chose to create a topic around understanding FASD. And under that topic, we developed 4 resources. So I've just included on that slide a couple of screen grabs from the resources, but Julia in the chat will also be sending through a link to this topic page if you want to look at anything in more depth as well. So the first topic, or the first resource we developed for this topic is a text-based resource called Understanding FASD in a School Environment. And this describes the ways in which FASD may present itself in the context of different school domains. So for example, classwork or numeracy, what behaviours that might look like in those contexts, with the aim of helping to familiarise primary school teaching and support staff with challenges that may be experienced by a child with FASD. The second resource is a video called What is FASD, which, in a surprise I think to no one, provides information on what FASD is and the impacts that it can have on an individual. Our third resource really tied into that lack of information about the referral and diagnostic process, and it outlines the 6 stages in the referral and diagnostic process after concerns are identified in schools. So it's really school focused, and it does have a particular emphasis and focus on the stages that would be most relevant for primary school teachers and support staff. And the 4th resource we have in this topic is a short video called A Day in the Life, what a child with FASD might experience during a day at school. And this depicts the common difficulties a child with FASD may have in the school and how this may affect and deplete their mood as the day goes on. So that is our first topic. Moving into our second topic, we chose to focus on classroom strategies. And I know I mentioned earlier when I spoke about the scoping review that there were quite a number of resources identified on this topic. But what we found through the quality assessment and the consultations was that they tended to be too long and were therefore not practical or particularly easy to use in a classroom setting. And again, some of them did lack that proper evidence-based evaluation. So we noticed that there really was a need for high quality, brief and short resources. So that's what we really chose to focus on and develop in this section as well. So for the classroom strategies topic, we developed 2 resources. The first is a fact sheet or a text-based resource, and it contains strategies that teaching and support staff can implement in the classroom to support a student with FASD in their ongoing learning. So some of the examples from the fact sheet are things like visual aids or maintaining structure and routine throughout the day. The second resource in this topic is also a fact sheet, and it contains adjustments and modifications that can be made to the classroom environment itself to support the child. So examples in this fact sheet might include minimizing visual distractions in the classroom or providing a calm and quiet breakaway space for a child. The third topic that we chose to focus on was family engagement. So this is a topic that really emerged quite strongly from our consultations with teachers and other primary school staff, was that there was a clear need for information and resources to assist educators to work with and support families of children with FASD in a way that is respectful and supportive, and it works to support the child and their family as best as possible through this. And for this topic, we also developed 2 resources. So the first that we developed for this topic is a fact sheet, and it's titled Collaborating with Parents and Caregivers. And it's an interactive information sheet with the aim of assisting teaching and support staff to communicate effectively together with a child's family when they notice a child is displaying challenges in the classroom. So it's one that teachers and families can come together and work through together, and really sort of supports and fosters that constructive and supportive conversations. The second is another short video that provides tips for engaging parents and caregivers when you notice a child is having difficulties in the classroom. So we've put together some clips from each of our 3 videos. So the What is FASD video, a day in the life of a student with FASD, and tips on engaging with parents and caregivers. We thought we would show you just to give you an idea of their content and also their style.
What is FASD? Fetal Alcohol Spectrum Disorder, FASD, is an umbrella term used to describe the impacts of alcohol exposure on the brain and body of an embryo or fetus. It's okay. We can go through the steps again like we did last week. Implementing evidence-based strategies that are consistent between school and home is very important for successful outcomes for students with FASD. Ongoing input from and communication with parents and caregivers is crucial for promoting consistent educational and behavioural practices across settings.
But yeah, that was just to give us a little quick overview of what some of the videos sort of talk about and cover and things like that. So then to move on to another feature or element of the website, I mentioned earlier that we evaluated all resources that we identified in the scoping review on their evidence base, their usability and quality. And a selection of those resources that scored highly and were relevant for the Australian context, they're also housed on the Learning with FASD website. So I've included a screen grab here of just how the resources are displayed at the end of each topic page. And it might be a bit too small, but I promise it's there when I tell you that for each external resource we link out to, we do provide a brief summary of the resource, its relevance to the topic that it's categorized under, and where the resource has been developed internationally in, say, Canada or the US. We do flag and note this on the website, and how it also applies to the Australian context. And I think really usefully for longer resources, we also list the pages that are most relevant for that topic. So you don't have to flick through the whole, if it's a longer guide, you don't have to flick through the whole thing. We sort of flag that going to page 4 is where you're going to find the information that you're looking for, with the aim of hopefully making it much easier to use and access the information in these resources. Each topic, so understanding FASD, classroom strategies, and family engagement, also have their own interactive quiz. So all quizzes are under 10 questions, so they're short and they're quick to get through, but they do cover the key points and the key takeaways from each topic. And as well, as you can see from the graphic on the far right of the slide, in addition to telling you whether you got the answer right or wrong, the page also provides the correct and additional information for each question. So I think a good learning activity, if you sort of have gone through a topic, say, and want to see how much you got from it, and interactive bits are always a bit more engaging and more fun to do as well. All right, so we did the research, planning and consultation phase. We developed learning with FASD, and the next step is to promote and disseminate it. And that's the phase that we're in now, and this webinar is part of it. So we're really excited to be here in this stage and be able to share with you all the work that we've done up until this point. So one of the first things that we do, or have done, I should say, to promote learning with FASD is an email and hard copy mail out to all primary schools in Australia. So this includes sort of an information pack, a little bit about what FASD is, a little bit about learning with FASD, and a brochure as well that includes information on the resources that are available. So really exciting that that's gone out. We also have set up social media, so you can follow us on Twitter and Facebook, where we do, share some information about what's on the website, as well as promote upcoming opportunities, and whether it be webinars or anything else that we might be doing in the future. And I think Julia as well is going to pop those links into the chat if you want to go that way. And we also have been promoting through our existing networks as well. The third is that we will be running quarterly webinars. So this is our first one, the first in our webinar series. So thank you again all for being here. But if there are any topics that you're particularly interested in hearing more about, or anything you'd like for us to cover in a webinar specifically, do please let us know. This can either be in the chat, the Q&A, or you can get in touch with us in the email address that we provided, I think, at the beginning slide, but it'll also come up again at the end slide. Another thing that we're doing is our quarterly e-newsletter. So you can also subscribe to this. Again, I think there will be a link in the chat as well. But yeah, we'll just be sending out a quarterly e-newsletter with, again, sort of similar content, things that are upcoming, new research that's maybe been done in this space, new developments from the Learning with FASD website. And it's only quarterly, so hopefully we won't be clogging up too many people's inboxes with that either. And we will also be attending some conferences and promoting and disseminating Learning with FASD that way as well. We also think it's really crucial to evaluate the usefulness and impact of Learning with FASD to really make sure that it's effectively meeting the needs of primary school teaching and support staff, and to be able to make any changes or amendments where necessary to make it even better. So because of this, we have set up a site evaluation survey. The QR code here will take you to the information sheet for the survey, and from there you can choose to go on to complete the survey or not. But yeah, we do encourage, if you've got thoughts and feedbacks you'd like, we do really encourage you to take part in that survey as well. So to summarize, Learning with FASD is a new website that houses evidence-based resources to help teaching and support staff to understand and support children with FASD in Australian primary schools. The 9 newly developed resources, along with a selection of existing high-quality resources, are organised around 3 topics on the website that were found to be really important, and there were gaps in it by our consultations and our scoping review. And these 3 topics are understanding FASD, classroom strategies, and family engagement. We are so excited to have launched Learning with FASD, and really thank you all for coming today and for hearing about it and letting us share with you what we have done. So you get a wee break from me talking just at you now for a while. We're going to move into our question section of today. So please, if you have any questions, any comments, pop them into the chat in the Q&A. I will be monitoring both of them. I will just stop the screen share, and if the speakers as well would like to put their cameras back on first, I might be throwing some questions your way as well. All right, thanks everyone. All right, so let's get started. So we have, let me just get my bearings on the chats and everything here now. Okay, so no particular order. I've got one here. Are there printable or electronic resources to support students during learning time? For example, language resources showing before and after for students who have confusions. So in our 2 resources for classroom strategies, we have linked out to a couple of resources and sort of printable materials that can be used to enact the strategy that we have included in that worksheet. So maybe Julia, I don't know if you could maybe link that through again, because I think there is quite a nice visual timetable that we've linked out to that could be really useful. All right. So I've got a question as well that the resources are specifically titled to be for primary settings. Is there a reason why the strategies aren't appropriate in a secondary setting? So I might start, but then I might throw out to Liz maybe to follow up, but I will start by saying that the reason that these resources specifically have focused in a primary setting is because the earlier that we can intervene and support children who may have FASD or be showing, behaviors consistent with FASD, the better and the higher chance of successful outcomes and better learning for them. So that's really why when we had this opportunity, we chose to focus directly on primary schools. But I don't know if maybe Elizabeth Pritchard or Elizabeth Elliot would like to expand on that a little bit more and speak to usability in other contexts, such as secondary schools or above.
Yeah, I'm currently in a secondary context this year, and I would absolutely use them in a secondary setting. I think the material can apply to all teachers anywhere, actually. I think the infographics and things like that are really nice when you're showing them to families, or if you're having these discussions with families. But you could certainly pitch this material cross school, cross campuses, to all staff. And just the ease of access is what is most important here, and the information that's been given. So I've certainly distributed the resources here at Barker College across the whole school, including careers and counselling department as well. So it's something that, yeah, I'm spreading beyond primary for sure, because they're just so easy to access and really easy to read, and really nice conversation starters with our families.
I could just add, I did certainly endorse that, Elizabeth, and of course some of these strategies are entirely applicable for older children, particularly children who are of a lower developmental age. But we do intend to try and develop some resources for secondary schools as well, to take in those sort of extra issues that might arise in adolescent children.
Yeah, absolutely. We are hoping this is just the beginning of learning with FASD, and that there is much more to come. So stay tuned and watch this space. Hopefully some exciting updates soon.
And just to say, Emma, it's so great to have that question, because it gives us a sense about where things, where we might have some gaps or some areas of need that we could potentially fill. So we were thinking very strongly about that, and we had a lot of evidence from the experts who'd advised us that maybe we should think about resources and for secondary school. So great question. Thank you for asking that.
Absolutely. So we have, we've answered this one. So we have a question that I think maybe, sorry, I keep referring to both of you, Liz, by your full names just to distinguish between you, but I think this is actually one that maybe both of you might be well placed to answer. So we have a question from Yvonne, who's wondering if there's been a change in New South Wales public schools around the recognition and support for children with FASD. It's been my experience that as FASD haven't been recognised by the DSM-5, it's harder to apply for supports in the classroom. Do you have any sort of comments you'd like to add on that? Or
From my perspective in both the public and the private school sectors, I would certainly be accessing counsellor advice or psychologist advice, depending who you have supporting your learning support teams or your teacher teams. Here in the private school sector, there's certainly conversations being had around FASD, open conversations. We have students on site with a history, so and certainly those conversations have been had. In the public school system, would definitely be talking to your school counsellor liaison through your executive team and starting those conversations there if you believe there's an imputed diagnosis or you suspect that there's flags there along this path. Would be certainly talking to your your counsellor who's on your site, or the counsellor that's allocated to your district, as I know not every school has someone on site every day that you can talk to. In the public sector, resources are a little bit more scarce. So I would certainly be approaching your executive team and then seeking out the designated counsellor to your school.
Did you want to add anything, Liz Elliot, or?
Well, not really. Of course, many of the children that you see with neurodevelopmental problems in the primary school setting may not yet have a diagnosis, is also a possibility. So really our concern is that children that you're worried about do get a proper assessment so that we can understand what their strengths are, what their needs are, and that we can put in place the right interventions, whether they be health interventions or educational interventions to support that child's needs.
Absolutely. Next, I've got another question that I think Liz Elliot might be very well placed to answer for us. So it's a question about whether there's a difference between the impact of drugs compared to alcohol and how that ties into fetal alcohol spectrum disorder.
Well, look, we know that alcohol directly crosses the placenta and is toxic to the developing brain, and that is what results in the learning, behavioural and developmental problems that we see in fetal alcohol spectrum disorder. There's emerging evidence that other drugs, for example, cannabis and perhaps methamphetamines, may also have an additive effect. They don't seem to have quite the destructive effect on the brain that alcohol has, but of course we're always interested in whether there have been multiple exposures, and particularly in making it clear to women who are planning a pregnancy or who are pregnant that really they need to minimise exposures to alcohol and a range of other drugs, and that they should seek help from their general practitioner or obstetrician about prescribed drugs also that may be harmful to the unborn child.
Yeah, so like it's definitely a sort of bit of a case by case, talk to your GP and just sort of minimize and avoid alcohol and drugs where possible at all times, ideally. We've got loads of questions coming through, so I'm trying to get through as many as we can. We have one question from Cheryl about how would resistance by families to discuss the possibility of FASD be managed? And I know this is a really tricky and complex issue, and something that one of our fact sheets does touch on, but somewhat briefly, given what else we were covering, that it's a brief resource. I wonder if Liz Pritchard, you had any experience of that, or I know Liz Elliot might be able to add to that also.
Yeah, they're really sensitive conversations, and I do recall having some myself with families. Again, same advice would be to talk to your executive team at your school and to certainly seek advice through the designated counsellor or counselling team at your school as to how to open the dialogue around these types of conversations, because they are very, very sensitive, and you don't want to offend or judge families, particularly when there could be distressing things happening at school and at the home. It's very, very sensitive. So I certainly wouldn't be cold calling a parent and having that conversation yourself, I would absolutely be seeking advice from your executive team, and then carrying that conversation through to whoever the school support or counselling liaison officer is for your school, and to discuss how to start that conversation. There could also be external medical professionals that are already supporting the family, and you can ask to have a meeting with them and the parents, and to maybe talk to them prior and discuss your concerns for that particular case. But it's certainly, in my experience, it's always best practice to present as a unified team when working with students and families with additional needs, and not to become confrontational or to start dialogue that is going to offend or start off on the wrong foot. So to always seek best practice through your executive and school counsellors to open the dialogue in a very professional and sensitive manner, and considering all that might be going on for that household, particularly if there's already a diagnosis existing and stress in the family. But to seek advice and then present as a team that we're here to work with you. We're concerned about the following. We want to do what's best for you and your family. This is the way forward. This is what we think we might like to explore, and to have the counselling or psychologists or medical professionals supporting you and having had prior conversations.
Yeah, if I could just add, Cheryl, thank you for the question. We make it very clear in the resources that we're not expecting teachers to make a diagnosis, but to recognise the neurodevelopmental and behavioural problems that might be consistent with that. So in my experience, it will usually be my patients who have a diagnosis taking that to the teachers. But really our key aim is to get people to recognise behaviours and learning difficulties, etc., that might be consistent. And then, as Elizabeth said, encourage parents, if you're worried and they're worried, to seek medical advice and then address the issue of the diagnosis as a team.
Yeah, absolutely.
Can I just add in there as well, Emma, that, it's a really good question, because schools are already doing so much in the space of looking after and caring for children's well-being, a huge amount. And one of the things that we were hoping with developing these resources, and Matilda and the educators and the University of Sydney partnering, was to actually try and open up the conversations. So maybe then it isn't quite as hard, because there is actually a beautiful resource that says there are things that we couldn't do. So some of that breaking down of the stigma, I really hope that helps. We don't want this, as Liz said, to be seen as extra work and a burden. This is really coming from the space of what can we produce, and I think Elizabeth said that so beautifully, Pritchard said that so beautifully. What can we produce that helps or that breaks down some of that stigma? Because in the end, if we can break that down a little bit, hopefully families can get help and a bit earlier.
Absolutely, and that will only benefit families and the students and everyone involved so much more. So absolutely, Marie, thank you. All right, we still have some questions to get through and a little bit more time, so I will throw some more to our panelists. So I think one that might have come up in a forum in a couple of ways is, first off, whether we have particular materials for Aboriginal communities. And at this stage, we haven't developed anything specific for different communities. We were sort of asked to create a national resource, so we have tried to keep it inclusive, sort of quite broad in that sense. But as with secondary school resources, that is something that we are very aware of and are very interested in pursuing in some of the next exciting stages to come with learning with FASD. So another watch this space as well. But there is some questions coming through that I think, Liz, Elliot, I might throw to you. So there's questions about being interested to know FASD numbers in Aboriginal communities, so whether there are differences, or where was the other one, sorry. I'm curious if there are any statistics research which indicate the percentage of Indigenous students versus non-Indigenous students with FASD. Are we dealing with greater prevalences in different regions? If you're able to speak a little bit to that.
Yes, look, thanks for that question. The first thing to say is that this is a problem throughout our society. It is not an Indigenous problem. But we know that there are some high-risk groups for fetal alcohol spectrum disorder. That includes children in the juvenile justice system, children in foster care, children in some remote Aboriginal communities where there have been high levels of alcohol use for many years. We don't have good prevalence data in the general Australian population, but we do know that in some high-risk Aboriginal groups, the prevalence is high. It's about 1 in 5 or 20%. And I noticed there was a question from Yeely, and we have done some work in the Fitzroy Valley in the Kimberley region of Western Australia, and we found a high prevalence there, but that won't be applicable across Aboriginal populations throughout Australia. So I guess the key message is to remember that Aboriginal women don't drink necessarily more than non-Aboriginal women, and that alcohol is a problem throughout all the socioeconomic status of our society. And we need to be aware of that. But we do need to be aware that in high-risk communities, particularly where there's been historic trauma, where there's current disadvantage, where there's poor housing, where there's domestic violence and ongoing drug and alcohol use, yes, the prevalence may be higher. We need to be alert to that. We need to focus on prevention, but we also need to focus on identifying those Aboriginal children who may need early intervention, really, to optimise their outcomes.
Absolutely. Thank you, Liz. All right, I've got quite another interesting one, I think, that's come through from Lisa that I will throw open to whoever would like to jump in, so I'm not picking on anyone in particular. But the teaching approach for FASD students is predominantly the same as other students with additional complex needs. Is there anything else significant, aside from behavioural aspects and family engagement, we need to consider as educators for the FASD context?
It's perhaps one answer to this question is that because alcohol can affect any part of the brain and any function of the brain, often these children really have multiple functional problems. And often the behaviours are the dominant problem. So it's very important early on to identify challenging behaviours and to direct parents to the appropriate help with child psychologists and child psychiatrists. I know we have some parents who are living with children with FASD on the line, and really what we learn from them is that the challenges are really significant and ongoing. And what we say with our patients is that we really should be picking off one thing at a time. What's the most worrying problem to the parent? What's the most worrying problem in the school setting? And let's try and address that. And that may be a behaviour. It may be a speech and language problem. It may be a specific learning disorder. It may be a problem with attention or impulse control. But let's try and address the problems that are causing the most issues immediately, so that that child can get back into some effective learning, which will in turn build self-esteem and enable us to address some of the other problems that we've identified.
Great, thank you, Liz.
Pritchard's got some comments there.
Yes, I absolutely agree with you, Liz, and with the person that's asked the question. Absolutely, I think a lot of, particularly in the primary setting, a lot of children with various diagnosis or imputed diagnosis are presenting in very similar ways. So there's lots of crossover here. So I really like the advice Liz has given there with picking the area or the behaviour that you want to focus on as a family and first, and to work from there. But absolutely, I can understand in a school setting there's going to always be, well, in the playground they're presenting this way, how do we deal with that? But in the classroom they're presenting this way, how does the teacher manage that? But then at home it's completely different. So I understand that there's a myriad of behaviours that families and schools are wanting to do their best for these children. But I do think as Liz has said, just talking to the families and creating a team that's working together and saying these are our priorities, and developing a very individualised approach for that particular student, that focuses on and discussing what the family's priorities are, what they want the future to look like for their child, and how best the school can manage and support, because every school is different in terms of the services that they can offer, the funding that they receive, the teachers that they're resourcing, and how much time they can allocate. So depending on your school setting, it's going to be dictated to how much support can be given. But I've always found that getting off on the right foot as a school community and having the family on board with any external professionals and having regular meetings, whether they're online or face-to-face, however it works, for that team to have a very cohesive approach to supporting all of these beautiful kids.
Now, Cheryl makes a comment that we should have an individualised approach, as you've just said, Elizabeth, focusing on strengths and interests, and that's really important. Pick the things that the kids are good at or interested in.
Yeah, I think we might just wrap up with one last question that I think, just off the back of what you were saying there of assessment, Liz, would be great to end on. So the question comes from Yvonne as well, and says, would you see the school support or counsellor having a role in implementing the audit C or a version of it to capture that initial acknowledgement of maternal alcohol use?
My personal opinion would be probably not. That I don't really think it's the role of teachers to document alcohol consumption during pregnancy. I think that's better in the realm of the health professional. And what we allow our parents to do also is to share however much or little of the information that we provide to them to the schools. And that will depend on what their relationship is with the school and the team at the school, and what sort of trust has been developed there. I'd be interested to hear others' viewpoints, but we certainly are not suggesting in our resources that teachers take that approach of interrogating mothers about alcohol consumption.
Yeah, I think to reiterate, that's definitely the point we've made in the referral guide, where we've really focused on the roles that a teacher can have, and as you say, Liz, screening was not one of them, or assessment was not one of them. So,
having said that, in some settings where parents and teachers know each other very well, it will be acknowledged that a mum might have a problem with alcohol, and that might just raise the index of suspicion in the teacher about the developmental and behavioural problems in that child, and push them to ask that mother to refer the child for a medical assessment.
Yeah, absolutely. Sorry, Marie, did we interrupt you there?
No, that's okay. That was perfect answers, and really, really important question, because it brings up the fact that we really were trying to go with a very positive and strength-based approach with this resource, and start those dialogues. So absolutely. I think definitely we would hold back on doing assessments.
Thanks, Marie. All right, I notice it's gone 1:30, so I will just get our last slide up and ask Marie to close our webinar today for us. And yeah, big thank yous to everyone, which I'm sure Marie can cover for us.
Yes, no, thank you very much. Thank you very much to all of our presenters, to Elizabeth Elliot, to Elizabeth Pritchard, and to Emma Devine, to everyone who has been involved in the Learning with FASD resources, including many of the people who are online here today. Thank you so much for sharing your knowledge and your lived experience with us. And to say that we're just absolutely delighted to be launching Learning with FASD. It was fascinating to have that conversation with you all. Please get on and have a look and give us feedback and evaluation of the survey. There's a little PR code there, so please join in the conversation with us longer term. Thank you very much, everyone.